Cardiovascular disease is narrowing of the arteries in your heart, in the vessels that carry blood to other organs in your body. It comes from plaque, cholesterol deposits that stick to the walls of the artery or form under the surface of the lining of the artery. Cardiovascular disease is the #1 killer in America. Are you over age 40? Do you have a family member who's had heart disease? Do you have diabetes, or do we suspect you may be insulin resistant? If any of those things are true, you may very well be at risk. One very important tool that we use as lipidologists is to look at the arteries. We actually look at your arteries with ultrasound, and we can tell if you have changes forming in your arteries of cardiovascular disease. CIMT is an ultrasound exam of your arteries, your carotid arteries here. And using ultrasound with high resolution, we can see the lining in the wall of the artery. We can see early changes of plaque. We can see thickening that happens as the arteries develop disease. Blood tests are helpful. They only tell us part of the story. Things like cholesterol levels, even genetic tests, they tell us some things about risk, but ultrasound shows us real disease in real arteries. The test is actually very easy. You come to our clinic, we put cool gel on your neck, and using a small transducer, just pass the transducer up and down along the skin of your neck. It's that easy. We look at the arteries in your neck because they are easy to get to and a reliable source of information for the ultrasound. And there are other places that we have studied, but none studied as thoroughly as the carotid artery in your neck. I like this test as a lipidologist because I can see real disease. I can show you what's going on in your arteries. We can watch it change over time, if it gets better, if it gets worse, with different therapies. It's very, very useful in my clinical practice. The report's going to show us the thickness of the wall of your arteries. We can compare that to tables of thousands of people just like you. From that, we know, are your arteries too thick already? Most importantly, are your arteries forming any plaque? As a lipidologist, I use this information to pick therapy just for you. If you understand your risk very well, and I understand your risk very well, and we understand the real disease process that's going on in your arteries, together as a team, we can beat cardiovascular disease. When the test is done, a report will be generated. When I get the information, I sit down with you and we go over it together. When you understand what's going on in your arteries, and you understand your own risk, together we can make a treatment plan to beat cardiovascular disease. You know, finding out that you have thickening in the wall of your arteries or plaque in your arteries can at first seem devastating, but that's not bad news. When you find out ahead of time that you are at risk, you've got a chance. We can do something about this.
Tonight's special segment, Eyeing Your Arteries. Now, you may look and feel one way on the outside, but your arteries could actually be functioning older than they really are on the inside. Our Health Beat reporter Sylvia Perez is here to explain why this is important and also how doctors are now figuring this out.
Alan, blood pressure, I should say, weight, family history, these are the typical risk factors for heart disease and stroke. But some cardiologists think they now have another powerful tool to determine the risk of cardiovascular disease. It is an easy, pain-free imaging test that peers into arteries to give patients a heads up about their coronary health and whether it is heading for trouble. Happy birthday! They come once a year, whether we like it or not. Our birthday determines our chronological age or the number of years we've been alive. But some cardiologists say there's another number we need to learn about, something called vascular age, and it can be calculated with a special FDA-approved procedure.
It's a test where we can measure the first two layers of the carotid artery and get a measurement of the earliest phase of atherosclerosis or hardening of the arteries.
The thicker the artery, the older or less healthy it is. That estimated thickness is what helps determine an approximate age for the artery. For example, Linda Brennan will be 60 this year, but her arteries were looking like those of a much older woman.
We'll be 60 and my vascular was 80. That's 20 years. That's not too good.
The University of Chicago Medical Center now offers this procedure called the CIMT test to patients. Several hospital employees were the first to give it a try. It uses standard ultrasound technology to provide a view of the carotid artery, which carries blood from the heart to the brain.
The thickening in your carotid artery, again, mimics thickening or atherosclerosis that's developing throughout your body.
Measuring the wall thickness is an old idea. What's new is the computer program that then takes that measurement and calculates a vascular age based on the thickness and your chronological age. The idea is to give patients a sense of what's going on in their arteries long before there are any symptoms or signs of problems, so steps can then be taken to halt the damage or reverse it.
It can serve as both incentive for patients to enact healthy lifestyles, both diet and exercise, and it can also be used by physicians to change targets or medication adjustments to try to treat those risk factors.
Keith Collins gets plenty of exercise and claims to eat well. His vascular age was calculated at 31, not bad for a 41-year-old man.
I just wanted to see if I was doing the right things.
The test is for people who are symptom-free, but with risk factors such as being 40 and older, having a family history of heart disease or stroke, being overweight, or having high blood pressure or high cholesterol. Linda has been dealing with several medical issues. She says her vascular age of 80 is a wake-up call and now realizes she needs to think seriously about diet and exercise.
It hits home. Definitely hits home.
Experts say this test is accurate and it is safe. The cost is about $325, and that would likely have to be paid out of pocket. Some cardiologists would like to see more research that proves the test can, in fact, help prevent a first heart attack or stroke. This test is user-friendly, so patients can understand the results along with their doctors. That's important.
Yes, it is.
But there is a simple and quick test that could help you from becoming a medical statistic. Dr. Darren Clare is here with his patient Brigida and technician Don to use a non-invasive, state-of-the-art diagnostic tool. Welcome to you all.
Thank you.
And what we're going to be doing here is we're going to be doing an ultrasound of the carotid artery. The carotid artery, it's on both sides of the neck, a very important artery because it supplies blood to your brain. And what we're going to talk about is ultrasound, because ultrasounds of the carotid artery can measure Intima-media thickness as well as look for plaque. Those can, believe it or not, be an early sign of atherosclerosis, which is hardening of your arteries, which, believe it or not, if you see it up here in your neck and your carotid arteries, it can also exist in the arteries that supply your heart muscle, putting you at risk for heart disease. But, Dr. Clare, ultrasound's been around for a long time, so what's unique about this technology?
This test, which is the HeartSmart IMT Plus, with the Devo technology in it, just by doing this test in my office, which is safe, quick, totally painless, I can know with a 95% certainty if you have any plaque building up in your heart, what type it is, and how severe it is.
So, Don, why don't you start imaging Brigitta's carotid artery, and we'll look at some images. And so you're going to hear the phrase IMT, that's Intima-media thickness. That's basically the thickness of the arterial wall. You don't want it to be too thick because that can be a sign of your increased risk for stroke, heart attack, etc. So right now, we're working to get the image of her carotid artery, and Walk us through what we're seeing, Dr. Clare.
Okay, I'd love to, Travis. Right here you're seeing the carotid artery. We're looking in sort of through the side of a straw. You can see the intima, this fine white line right there, which again is the Intima-media is where the thickening occurs, which leads to atherosclerosis and in certain people leads to plaque formation.
And the Intima-media are literally, that's what makes up your arterial wall. Now, we have some images of good arteries versus unhealthy arteries. Show us what we're looking at.
Okay, great. This right here is a healthy artery. The Intima-media is right here. It's this inner fine white line. That's what we're measuring. That's where the correlation is. You can see this is a little thick, but very significantly, where the red circle is, this person not only has thickening, they also have a big, nasty plaque sticking into the lumen of the artery.
And so what people are looking at there is plaque in the carotid artery, which if it breaks off, it can actually go up to your brain and cause a stroke there as well. So
that's right.
One of the things that you've done is you've taken images from Brigitte and you've actually mapped them out to give a letter grade. A is good, E is bad, and if you're in between there, you have to have some concern. Walk us through this chart.
Okay, yeah. The way I like to think about it is just like your report card from school, okay? A is great. E, I say, go to the emergency room, okay?
And Brigitte's was normal, right?
Brigitte's is totally normal.
And secondly, we measured the plaque character.
Yeah, because there's different types of plaque. There's the soft plaque and the hard plaque. A lot of cardiologists will now tell you that the soft plaque, which this test will pick up, is actually more dangerous because it's vulnerable. And by that we mean that it's more likely to rupture, causing the problems that we were just talking about.
And Brigitte, you were an A once again on the report card. None observed, no plaques. And finally, percent stenosis or narrowing of the artery.
Yeah, this is an important part of the test, and we can then realize that this person is at an early stage of heart disease, and we can then put them on a program to help reverse it and push them back towards A.
And this is great takeaway for those of you at home. Heart disease, the #1 killer of women. The #1 killer of women, also the #1 killer of men. And the reason that you do studies like this, if you are at risk, you need to talk with your doctor about getting studies done to figure out how bad your heart disease may be, because believe it or not, you can reverse it with things like your diet. These are great foods, increasing your activity level, simple changes, lowering your blood pressure. These can all help you live a longer, happier, healthier life and reverse the damage of heart disease. Thank you so much, Dr. Clare. Thank you, Dawn. Thank you, Brigitte.